I'm incredibly honored to be introducing Congresswoman Anna Eshoo today, who has been a tireless advocate for healthcare innovation for decades. She served this community in the House of Representatives since 1993. She was the first woman ever to serve as the chair of the Health Subcommittee. And she's just a visionary who fully grasps the urgency of action on mental health and the need for innovation. Some of her recent support includes the support of the Bipartisan Mental Health and Wellbeing Act, as well as ARPA-H, High Risk, High Reward Research Agency for Biomedical Practices. So please join me in welcoming Anna Eshoo.
Wow, wait till I tell my kids. Wait till I tell my kids. Good morning, everyone. It's really wonderful to be with you. Actually, it's an honor. Thank you for your very kind introduction. And thank you to the Tony Blair Institute for Global Change, the Stanford Healthcare Innovation Lab, including your founder, Dr. Mike Snyder, for your essential leadership and your vision in tackling the really difficult challenges facing our nation's healthcare. Included in my thanks are these original mood chews. I don't know if you read the fine print. Support for overwhelm, anxiety, and stress. I think I need a case of these. So thank you. Thank you. Maybe my colleagues will notice the difference after my 20 minutes of chewing. Okay, on to the serious stuff. Clearly, our nation is facing a mental health crisis, and we must act. I couldn't help but note the differences with the exercise that you just went through here and what our caucus meetings are like in Washington, D.C. There's a huge gap between the two. The American Academy of Pediatrics, the American Academy of Child and Adolescent Psychiatry, and the Children's Hospital Association in our country have declared a national emergency in youth mental health. Emergency department visits for children's mental health more than doubled between 2016 and 2020. I've met repeatedly with representatives working really closely with Lucille Packard about kids in mental health crisis boarding in emergency department facilities until they can be admitted into specialized mental health treatment. There's nowhere else for them to go. And this is one of the most extraordinary areas in terms of resources in our country. But that's the case right here. It's not just our kids. In 2021, there were over 100,000 drug overdose deaths in the United States, a 30% increase. This year, nearly 50,000 Americans died by suicide. Despite the frequency of mental health illness, too many suffer in silence. So many of us know this from our own families. Mental health, I've thought, is really the stepchild in our healthcare system. Less than 40% of adults with mental illness receive treatment, and approximately half of the children with mental disorders do not receive any care. This, to say inadequate, doesn't begin to describe it. This mental health system is due to insufficient insurance coverage, limited options due to poor provider reimbursements, and an aging system that too often relies on prisons, jails, and shelters to take care of people in mental health crisis. The good news is that Congress is taking up many strong bills to address these issues. First, the Health Subcommittee I chair, and thank you for noting that, since our country was born, I'm the first woman to chair that all-important committee. We passed the Restoring Hope for Mental Health and Wellbeing Act. The bill addresses the opioid epidemic, including the ending of arbitrary caps on the number of patients a doctor can treat for opioid use disorder using buprenorphine. It also increases access to mental health services by paying for more community behavioral health workers and telehealth services. Importantly, addressing our mental health crisis is bipartisan. And it's something that people ask me about on a consistent basis. The media doesn't carry anything when it's bipartisan. They love, they love conflict. That's what they report on. So the Restoring Hope Act passed the House of Representatives in June with an overwhelming vote, 402 ayes and 20 noes. Don't ask me about the noes. And the bill should be bipartisan because if you're sick and you need help, it doesn't matter whether you're a Republican or a Democrat. And to address the pediatric mental health crisis, I introduced the Strengthen Kids Mental Health Now Act, working very closely with Packard, but with all the children's hospitals in the country, with their national association. This is a comprehensive bill. It doesn't take a slice of the system. It's comprehensive, and it's what we need. It supports the entire continuum of mental health care for children by increasing reimbursements for pediatric mental health services through Medicaid, so families don't have to wait months to see a healthcare professional. The bill also creates new grant programs to expand our national capacity to deliver appropriate care for children. I'm so thankful to the experts at Packard and Stanford who advised me, who counseled me as I wrote this all-important legislation. Now, beyond fixing the barriers that keep people from accessing care, we also need high-risk, high-reward innovation to address our nation's mental health crisis. In March of last year, I sat in the Oval Office with 8 other bipartisan members of the House and Senate and heard President Biden describe his vision for a DARPA-like effort for healthcare. This new independent advanced research projects agency for health would take our nation to the next frontier in biomedical research. It would make investments in projects to develop breakthrough treatment and cures that are still too risky for the commercial market to pursue. That afternoon, I returned from the White House and got to work on the ARPA-H Act. This legislation will address serious mental illnesses like schizophrenia, opioid use disorder, and bipolar disorder by pursuing large-scale, high-risk projects. It will help find cures for diseases such as ALS, Alzheimer's, glioblastoma that are death sentences today. When someone receives a diagnosis for these diseases, they are death sentences. And glioblastoma took 2 of our great leaders of our country, Senator Ted Kennedy and Senator from Arizona, John McCain. My ARPA-H Act passed the House. It was really tough. I have to tell you this. I started out with skeptical Democrats and flat out no's on the Republican side. So when I tell you that it was a bipartisan vote of 336 to 85, it was an hallelujah day. So now I'm working with the Senate, who my observation of the Senate, it doesn't have any sense of urgency. It is, it's a different place. But I'm working with them so that hopefully, by the end of this Congress, ARPA-H will become the law of the land. So in this audience today, there are many researchers who are you're pursuing bold and unconventional health projects. I think that a well-designed ARPA-H is going to help those projects achieve really the really urgent progress that we need to make. People with deadly diagnoses don't have the luxury of time. Later on today, I'm going to, at the request of this constituent's mother, is to go by and to visit with a young woman, Jamie Berry. 2 years ago, she was diagnosed with ALS. Today, she's quadriplegic. In a letter that she wrote to me as we were working on this legislation, she said, with ALS, a piece of you dies every single day. We're simply asking for a fighting chance to live the lives we were meant to live. So Jamie and all the Jamies are, I carry them with me every day. And I think you do too. My work in Congress and your work in the lab is to help create this fighting chance that Jamie speaks to against these deadly diseases. And I think that today's summit is going to contribute to that urgently needed progress. I look forward to working with Stanford, the Tony Blair Institute, and each of you to make what is seemingly impossible today a reality for people across our country. And when we make that progress, we make it for the world. We make it for the world. It's not just self-contained within these 50 states. So I hope that my great hope is that in our day and our time, we'll make these a reality. So bravo to all of you. I am more than privileged to represent Stanford, and it really is the work of each one of us, but together to blast through the impossibilities. So thank you for having me here today. It's really a joy to be with you. And I want you to know that you give me a great deal of hope. And hopefully that my work will not only give hope to the nation, but the world. So thank you, everyone, and bravo to all of you. And thanks for the move shoes.